hands on you, on the leg. If at any time you feel uncomfortable, just let me know. Is that okay with you?
Yeah, it's fine.
Okay. All right. So if I could just get you to go ahead and take a few steps forward so I can see what you look like. One more. Okay. All right. So the contraindications are joint pathologies and muscle pathologies of the lower extremity and weight-bearing restrictions. We do gait training so that we can facilitate their ambulation status, so that they can be more independent with their gait after they have a stroke or whatever causes them to become hemiplegic. So the gait belt and proper guarding of the involved extremity or involved side is crucial to this skill. So what we're going to do first is I'm going to put my hands on your hips, okay? We're going to, the therapist can be in front with their hands on the hips so that you can facilitate weight shifting. You can tap to facilitate motion or movement. And then you want to be blocking that involved knee on the hemiplegic side so that it doesn't collapse. And what that'll allow you to do too is hook your foot behind theirs to move that, to advance that involved leg forward. So first thing we're going to do is I'm going to have you shift your weight onto your uninvolved side. So shift to the left. Now what I want you to do, shift it to the right. And then I want you to take a step forward with that left leg for me. There you go. And then while blocking her knee, I can go ahead and have her shift her weight onto her left side. And then go ahead and try to take a step forward. Step. There you go. Just like that. And then shift your weight onto your right side. Take a step forward. Now shift your weight back onto your left side. And then I can, to facilitate motion with her step forward on her hemiplegic side, I can do facilitation techniques like tapping and get her to flex that hip, or I can reach behind and tap on her hamstrings to get some knee flexion out so she can clear, or tap on her anterior compartment to get some dorsiflexion. And that's pretty much it for hemiplegic. You can break these down into part learning. So you can have her work on knee flexion, hip flexion, dorsiflexion, before you come to the parallel bars to do some gait, kind of get some, try to facilitate some movement out of there. Okay, so we're going to have a taxic gait looks like right now, so go ahead and walk towards me. Okay. All right, go ahead and go back to where you were. So for patients with ataxic gait, don't stand in front of them because they might run you over. Stand behind. Make sure you have a good grip on the gait belt. Okay, go ahead and walk forward for me. Very good. Okay, so back up. For ataxic gait, they are having trouble coordinating their movements. So what you need to do to facilitate, go ahead and scoot back a little bit. To facilitate coordinated movements, you can have her perform exercises where she needs to pay attention to where she's stepping. So you can put marks on the floor, or you can have her come forward. So what I want you to do is take a step onto my toes with your left foot. There you go. Now take a step on that foot, that foot, that foot, that foot. Very good. And you can do this to get her used to her coordinated movements with stepping. Of course, you don't want to do that, have her step on your toes the entire time because she won't get that proper heel stride pattern. You can break. The best thing to do is have the patient hold on to the parallel bars, and you can have them do separate movements. Break it down into part practice learning. So go ahead and take a step forward and strike your heel onto the ground with your right foot. Bring it back. And then your left foot. Bring it back. And your right foot again. bring it back. And then you can also have her do step-ups onto a platform while holding the parallel bars. So what I want you to do is just bring your left foot up, tap it on the box, bring it down. Bring your right foot up, tap it on the box, bring it down. Very good. So just coordinated movements to get her motor program to relearn these coordinated movements.
Go.
Okay, so for spastic gait pattern, we're going to show you what that gait pattern looks like. For it's the same thing for spastic as it is with ataxic. Don't stand in front of the patient. They could bowl you over. Make sure you stand behind them, have a good grip on their gait belt. Go ahead and walk forward for me. There you go.
Sorry.
Ready? Okay, go ahead. Very good. Okay, go back over there. So for spastic gait, they're stuck in extensor tone. That's why they're walking on their toes, crossing over, because they're going into adduction. So what we want to do here is we want to do some inhibition techniques that we learned earlier in neuro to inhibit that extensor tone. So you can, I'm not going to go over all the inhibition techniques, but once you inhibit the extensor tone and get get her out of that extensor tone, then you can do some facilitation to increase her flexor tone, which will help her with her gait pattern. So you can have her the same thing. You can have your hand on her hips, or on the patient's hips, and then you can facilitate hip flexion by tapping on the quadriceps. And then you can, at the same time, be facilitating knee flexion so that she comes into that nice towards 90-90 position. And then you can facilitate by tapping on her dorsiflexors to get her into that dorsiflexion. And then you can do that while walking. So what I want you to do is go ahead and take a step forward with your left leg for me. Very good. Now go ahead and take a step forward with your left leg. Left leg. Left leg. There you go. Just like that. Okay, so the next gait pattern we're going to show you is patients with Parkinson's have trouble. They have festering gait and bradykinesia. So make sure when you're working with a patient that has Parkinson's, don't stand in front of them when you're doing gait training, because they can either take it as a barrier because they have trouble initiating, so they're not going to initiate, or they will run you over like any other gait. So we're going to go ahead and show you what that looks like right now. Go ahead. Back.
Awesome.
So that's what that looks like. They have trouble initiating their motor program. So what you can do, some things to get them to initiate that motor program, is you can give them guided steps. So when they're walking, so they can hold on to the parallel bars, and you can make marks with tape on the floor and have them step onto those pieces of tape so that they have a target that breaks them out of that motor program. So go ahead, and what I want you to do is take a step onto this black piece of tape with your left foot. Now take a step on this hole with your right foot. Black tape with your right foot. There you go. Very good. Okay, and then turn around. And then other things you can do, just like with any other gait pattern, you can have them build up to their motor program. So once they look down at their feet, and they've been doing it for a while, looking as they have them look forward, make it more difficult for them so that they know how far to step, and they'll try to reprogram that motor program. And then you can have them break this into part practice too, just have them take small steps with each foot so that they can initiate that.